Hi there, this is Karen Finnan and I am here with my mate George to talk to you a little bit about the lower back and more specifically the discs in our lower back. These are a very commonly injured structure, particularly by curling over a laptop and spending a lot of time sitting and bending over. So I wanted to show you how they work, what can go wrong, and most importantly for us all, how we can avoid damage to our discs altogether. So basically, our lower back is known as the lumbar region of our spine, and it's the bottom 5 vertebrae, okay? Now in between these vertebrae, you'll notice there are these little discs, okay? Now where the bones are hard, the discs are actually squishy and rubbery, and that's what allows our spinal column to have flexibility and to bend and to move. Now if we look a little bit more closely at the anatomy of these discs, you'll find that they're rings and rings of fibrous tissue surrounding a little pocket nucleus of jelly in the middle, okay? And that disc sits between the 2 vertebral bodies. Now with the normal mechanics of movement, what happens is when we bend forwards, that disc compresses at the front and that therefore pushes the jelly towards the back wall of the disc. When we bend backwards, it's the opposite. The disc compresses at the back and it pushes the jelly towards the front of the disc, okay? But unfortunately, in our lives these days, a lot of what we do is flexed or forwards. We sit in the car, we sit on the bus, we curl over our laptop, we sit with friends for a coffee, we sit and have dinner, we sit and watch Netflix. So we're doing a lot flexed and very little straight or back the other way. And what happens over time is that that disc's compressed at the front a lot, the jelly pushes to the back wall of the disc a lot, and that can cause little fissures or little tears in the back wall of the disc. Now you can be sustaining this damage, internal damage to the back wall of your disc, without you having any pain at all, because the nerve supply is only to the very outer edge of the disc, and it's the nerve supply that alerts our brain that something is wrong. So damage to the back wall of the disc from sitting, from poor postures, from bending over a lot, can be building up without us even knowing it over weeks, months, or even years. And then sometimes a seemingly cryptic event like bending over to pick up your pen can suddenly activate a world of pain, and that is the signal finally getting to your brain that something is wrong with your disc. Your brain sends back a message saying spasm up all the muscles in the area to try and protect it, and you feel locked up, sore, and in a lot of pain. But it doesn't have to be this way. Our spine is the happiest when we're upright and straight, and in fact, when we have a little hollow, a little inward curve in our lower back. So if we can maintain that position with the bulk of the activities that we're doing, that's going to help our discs to avoid developing that damage. Sort of things we're talking about is when we're sitting at our laptop, making sure we're supported and that we have maybe a cushion or a rolled up towel in our lower back. It means when we're sitting in the car that we're sitting up nice and straight with our bottom at the back of the seat. It means if we are sitting for a lot that we break it up and walk around so that we're back into upright positions. And there's a few exercises that you can do as well that will show you that are arching back the other way. Problems with discs in the lower back are really, really common, and they can be incredibly debilitating. Once you have them once, the recurrence rate is incredibly high, so we really want to avoid it altogether. Look after your spine, keep it in a neutral upright position, and do the exercises, and you can avoid trouble with your lower back. We'll see you next time.